All right, so I wanted to talk to you about a topic with the heart. So this is near and dear to me, coronary artery disease. So a lot of athletes who have been endurance athletes in the past can end up with heart disease. It doesn't mean because you were a great athlete, high school, college, as an adult, going into your 40s, 50s, 60s, it doesn't mean that you are immune from coronary artery disease. So it can be challenging to assess whether or not a lifelong athlete has coronary artery disease if they don't have symptoms. And one of the main tests is a treadmill test where you're hooked up to an EKG, which is a heart tracing, and you're on a treadmill, and the treadmill starts flat. And over a certain amount of time, the treadmill starts to rise. And then over a certain amount of time, it rises again. So what's happening is, as you are running, you are having to do more work, which is requiring more oxygen, which is then putting your heart at greater and greater strain. So one of the issues with athletes is, hey, we're good at doing work. We're good at running, or we're good at lifting, or we're just good at putting ourselves in motion and keeping ourselves in motion. We're also really good at pushing past pain. So a test like this isn't necessarily going to pick up coronary artery disease if you don't have symptoms. So there is a test. It's called a coronary artery calcium score. Coronary artery calcium score. You'll see this sometimes as a CAC. CAC, coronary artery calcium score. And usually these are anywhere from about $120, maybe $150. There is a company that does a more, let's just say, detailed analysis. That one's going to run you several $100s, but they will also do comparisons for you for previous tests. So this is a test that you do not want to score high on. If you're scoring high on this test, that means compared to your peers, you have calcium in your coronary arteries. You're not supposed to have calcium in your coronary arteries. If that calcium is present, what that means is you have plaque. You have plaque in your arteries, and that plaque is making the lumen, making that area in the coronary artery where the blood is supposed to be flowing, it's making it smaller and smaller, tighter and tighter. And if it closes, you're not getting any blood flow to that area that artery feeds to your heart muscle. The other danger is it might be open, but if the plaque ruptures, and imagine a river with a dam all of a sudden, and none of that blood can flow past that dam, same situation. You're not getting blood flow to the muscle of the heart downstream, and that muscle is going to be damaged. That muscle is going to die. So, or I should say it could die. So a coronary artery calcium score is something that you can get. It's not the end all be all, but it is a really good piece of information, because if you do have calcium present, now you know, and now you can start to do something about it rather than waiting until you have a heart attack. So, a lot of folks that I see, and you're probably one of these, if you're watching this, you're probably proactive about your health. So I want you to know what's available so you can do something. If you have heart disease, if people in your family have had heart attacks, your parents, grandparents, aunties, uncles, brothers, sisters, then this is something that you should know about. And, at the price point, something being between $100 and $200, that information could be invaluable. So again, coronary artery calcium score. It's something you should be able to get in most parts of the country. It's a fairly fast exam. You do have to lay down and be still and be able to go into the CT scan, but it's fairly quick. So even if you don't like, being inside of that donut, it's only going to be a few minutes, 5 minutes probably at the most. When I had mine done, I spent more time in the waiting room than I did actually on that table and in going into the CT and coming out. So it gets a really detailed picture of your coronary arteries. So it's looking at their heart, but it's looking at the coronary arteries that are feeding the heart. It's feeding the muscles of the heart. The heart is a muscle that is a pump. All right, so coronary artery calcium score. Check it out. Thanks, bye.